everyone, and welcome to the October edition of Stop Diabetes Insight. We have an exciting show for you today. You know, there are a lot of questions surrounding all the medications that people with diabetes need to take. And so we have with us a guest today, Nicole Stagge. She's a PharmD candidate with Butler University and also working with Kroger Pharmacy. And so she's going to share information with us in a little while. But first we want to talk to you about happenings at the ADA. We want to say happy autumn to you.
Yes.
It's such beautiful weather right now, and this
gorgeous.
is my favorite time of the year.
It's cardigan weather. I love it.
Cardigan weather, there we go. And you know, it's also great walking weather. So this past weekend, I participated in the Great Pumpkin 5K and then spent the entire day at an apple orchard and pumpkin patch. So we were out walking all day, and it was just so beautiful. I was so excited when my Fitbit hit 16,000 steps.
Oh,
it's
wow.
like, whoa, it was awesome. Yeah. So, all right, well, let's jump in now to some happenings at the ADA. So coming up next month is American Diabetes Month. And this year, we want to showcase stories of people who are living with diabetes. So we'd like for you to share those stories with us. You know, anything that that just shows you managing your day-to-day life and what you also do to manage diabetes during any given day. So it could be a parent checking their child's blood sugar in the middle of the night. It could be a child and a grandmother just enjoying each other's company. So share your diabetes stories with us. And you can do that. You see our contact information there at the bottom. Our website's diabetes.org Indiana. You can hit us on Twitter or you can go to our Facebook page. So share your stories with us so that we can share those with the public in November. And then, Alyssa, what do you have for us?
So, it's almost time. It's almost time for gala.
Yeah.
The JK Lilly Gala that honors Dr. Fred Whitehouse this year, who's a leader in improving the lives of people with diabetes. The event takes place on November 5th. That's a Saturday at the Indiana Roof Ballroom. And we are in need of volunteers. We need volunteers from helping out with registration to helping out with our auction table hosting to make sure that our guests pick the right item. From also to our concierge service to our cleanup crew. We need individuals to help make this event a great success. So if you're interested in volunteering, please do. Contact our office. Our phone number is 317-352-9226, or feel free to also reach me by email, afreeman@diabetes.org. We have lots of great opportunities for you, so it's not just those, so please feel free to give us a call.
Tell us about the theme for Gala.
The theme. Oh, we're partying for a cure this year. The theme is Mardi Gras. So it's still black tie optional, but we also have that extra thrill of being able to dress for Mardi Gras. So it's going to be really exciting this year.
It will be fun.
Yeah.
And there will be a fabulous band. Our office is filling up with auction items
so
right
many
now.
auction items.
I keep looking. It's like, oh, I want that. I want that. I want this. You know,
I want it all.
I know. Yeah. All right. So then, following Gala, will be our National Healthy Lunch Day.
Yes.
And that's on November the 15th. And we're going to celebrate Healthy Lunch Day this year down on Georgia Street in downtown Indianapolis. So come and join us on November 15th from 11 a.m. to 2 p.m. downtown on Georgia Street. We're going to have food and music. It'll be healthy lunch food, but it'll still be delicious food. And we'll have music, and we're going to have some fun, maybe some Zumba going on. It's just going to be a great celebration to celebrate the fact that we can enjoy lunch and make it healthy all at the same time. So we hope to see you down there.
Absolutely. And as always, guys, if you want to know more about what's happening with the ADA in our Indianapolis office, please take a look at our social media. We have a Facebook page, a Twitter page, an Instagram page, and we're always updating on the latest happenings. So if you're interested in getting more information on diabetes, you can also stop by our office. We're located at 8604 Allisonville Road in the Castleton area. And you can also give us a call. Again, our phone number is area code 317-352-9226. Give us a call, and whether you're paying us a visit or giving us a call, we'll be happy to provide you with information that you need.
Absolutely. And something that's not on that contact page, but the American Diabetes Association National is on Pinterest too.
Oh, that's right.
So find us on Pinterest. I mean, we all spend a lot of time on there, right? So find us on Pinterest. We have a lot of different recipes and just fun activities on Pinterest. So find us there as well.
Absolutely.
Okay, so now we're going to have Nicole share with us her expertise on treating diabetes and all of the different medications. So Nicole, why don't you start out by telling us a little bit about yourself and what made you choose pharmacy for your career?
Okay. So my entire family is in the healthcare field. So I shadowed my mom at her work where she works with a lot of pharmacists, and I fell in love with pharmacy. I love being able to help people with their medications. It can be a complicated thing, especially when treating diabetes. So I love being able to talk to patients and help them figure out their diabetes medications.
Excellent. Okay. Well, let's get started.
Absolutely, absolutely. So, Nicole, I'm sure there are a lot of medications that are out there right now. But what could you tell us about the different oral medications that are currently out there?
Okay. So there are about five main classes that we'll talk about today of oral diabetes medications. So these are medications that your type 2 diabetics will be taking. So type 1 diabetics won't be taking oral medications. So our first one that's most common that almost all type 2 diabetic patients will be taking is metformin. So it works by decreasing the amount of sugar that your liver produces, and it increases your body's sensitivity to insulin. So it's, as I said, it's taken by almost all patients with type 2 diabetes. And even some patients, if you're diagnosed with pre-diabetes, you can start on metformin.
Yeah, I've heard of patients who have started on that to help.
Yeah, to help.
Metformin's kind of a wonder drug, it seems,
Right,
too. It's good for so
absolutely.
many different things, but
yes.
it's especially effective for diabetes.
Right, exactly. Some good things about metformin. So it doesn't cause your blood sugar to go too low on its own. So that's great with metformin. It also doesn't affect your weight at all. So it doesn't cause any weight gain. The biggest thing that we worry about with metformin side effect wise is stomach upset. So that happens a lot when you start the medication and then when you increase the dose. So it tends to go away after a couple weeks once you start it. And also, if you take the extended release tablet formulation, that can also help with the stomach upset. We do recommend that you do take it with food to prevent that as well. Some patients that may not be on metformin, if you have any kidney or liver problems or severe heart problems, they might not recommend metformin for you, and you'd move on to other options. So after metformin, we'll talk about the DPP-4 inhibitors. So DPP-4 is an enzyme, and if we inhibit that, we allow a protein in the body to increase insulin production. So that's how that one works. The options that are out there right now are Januvia, Onglyza, Tradjenta, and Nesina. So those might be medications that you'll be on. They can help the pancreas produce more insulin and help lower the amount of sugar made by the liver. These medications are really good if your blood sugar is really high after eating. So if you wake up in the morning and your blood sugar is fine, but later in the day after you've been eating a little bit, your blood sugar is really high, this may be a good medication for you to help bring that down. These also don't cause your blood sugar to go too low on their own and also don't affect your weight. A few side effects that we do worry about, it can cause some upper respiratory infection, headache, upset stomach, and then it can cause pancreatitis, but that's really rare. So just those are some things to look out for.
Okay.
So next we'll talk about the SGLT2 inhibitors. So SGLT2 is a transporter in your kidney, and by blocking that, we allow sugar to be excreted into your urine through your kidneys. So that's another way to get rid of that blood sugar. The medications that we have are Invokana, Jardiance, and Farxiga. These also don't cause your blood sugar to go too low on their own. And what's great about these are they can cause a little bit of weight loss, which is great for our diabetic patients.
Yes.
They can cause some yeast infections or urinary tract infections or a sore throat. So those are some things to look out for. It might be common.
Well, will it make you maybe have to go to the bathroom more often?
Yes,
Is that why?
yeah, that can too, because you're excreting your sugar through your urine, it may increase your have to go to the bathroom as well. This one is a once a day medication that you'll just want to take in the morning. If you have any kidney problems or if you're already at a high risk of urinary tract infections, you might not want to take this drug.
Okay.
So next we can talk about the sulfonylureas. So these are medications like glipizide, glyburide, and glimepiride, and they actually increase the amount of insulin that the pancreas produces. And these are really good if you have high fasting blood sugar. So if you wake up in the morning and take your glucose and it's really high, this might help those patients. However, this medication, something to look out for is it can cause your blood sugar to go too low. So you might have some hypoglycemia. So that's something that if you know you're not going to eat as well that day, or if you have something going on, if you're sick, this might be a medication that you want to talk to your doctor about. Talk to them about maybe skipping a dose that day if you know you're not going to be eating your regular meals, or
Maybe
changing your
have
dose around a little bit.
A snack with you, or something to
Right.
treat low blood sugar.
Yes,
should it
absolutely.
happen.
Yes, that'd be a great idea.
What are some things that people could use to treat their low blood sugar?
Anything, we like simple sugars, so any kind of like candy that you have is always good. You can always keep your glucose tablets. Kroger sells a little
Like a little
container
teddy
of them.
pack, or
Yeah,
kind of-
so that's just a nice thing you can have in your pocket, in your purse.
Nice.
Keep around with you if you're on
Okay.
those medications. And then this one can actually cause a little bit of weight gain, so that is something to look out for, and a little bit of upset stomach as well. So then we can move on to the next one. We call these the TZDs, a little easier to pronounce.
I was going to say, how many classes did it take to learn how to pronounce
Oh
this
yeah,
word?
a lot. So those medications are medications like pioglitazone and rosiglitazone. So these can help to also increase your body's sensitivity to insulin. It can't cause your blood sugar to go too low on its own, which is great. It can cause a little bit of weight gain, so that's something to look out for. It can cause swelling and can worsen your congestive heart failure as well. Can cause bone fractures in women and anemia. So if you have heart failure already or osteoporosis, these might not be the right
Okay.
medications for you. And a really good thing to note on this medication is right when you start it, it doesn't always work right away. So you may be continuing to check your blood sugars, and after a few weeks, you're like, why isn't it going down?
Right.
Well, these medications can take up to 12 weeks to to actually see the effects.
All right.
So that's a good thing to note. Don't stop taking it. It might start working.
Okay, that's important to know, because people do give up after a while. They're like,
absolutely.
this isn't
Yeah.
doing any good. Why am I paying for this? Why am
Right.
I doing it? So
Exactly.
Good point.
that's
Yeah.
a very good point to bring
Yeah,
up
so
to
stick
people.
with it.
So stay with it. Well, now I know that in addition to these oral medications, there are a lot of new injectable
Yes.
drugs for people with with type 2 diabetes that are not insulin.
Right.
You know, when we think injectable, we automatically go to insulin.
Exactly.
So tell us about some of these newer injectable medications and how they work.
So a big new class that has recently become a very, very big and helpful class for diabetic patients are the GLP-1 receptor agonists. So
That's a mouthful.
yes, yes. So it helps your body increase the production of insulin. So these are medications that we can use in type 2 diabetic patients. So typically when we think of type 1, we go right to insulin. But with type 2, you can do insulin, but you can do these other injectable medications or oral. So there's a bunch of options. But these GLP-1 receptor agonists are really becoming a large class that might be used if metformin's not controlling your blood sugar anymore. This might be the next line for you. So what's great is they have two agents that are actually, it's one injection a week, which is great because a lot of people don't want to inject themselves
Right.
more frequently.
That's
That's a great
fabulous.
option. So that's Tanzium and Bydureon. And then there's also drugs in this class that are daily or even twice daily. So that's agents like Trulicity, Byetta, and Victoza. So they are good to help decrease high glucose after eating. So they don't cause blood sugar to go too low, and one great thing about them is they can cause weight loss. So actually Victoza, another formulation of it, is actually FDA approved for weight loss.
Okay.
So these are really good with that. So that's great for our diabetic patients who are struggling to lose weight, who can't control their diabetes. This is a great option. So it can cause a little bit of stomach upset, so diarrhea, nausea, and there can be a little bit of redness or reaction at the injection site. So that's pretty normal.
Do you recommend people changing around their injection sites and
Yes,
not using the same site all of the
absolutely.
time?
You want to make sure you're not reusing a site within a week. So making sure that you can go around the abdomen, or just making sure that you want to prevent reusing the injection site.
Okay.
Yes. Okay. So now on to insulin.
Insulin.
Yes.
All right, perfect.
So there are several different types of insulin.
Exactly.
Yes. Yes, there
So
are
and
quite a few.
Yes, so everyone with type 1 diabetes uses insulin.
Right.
And there are short acting and long acting, and then some people with type 2 might just use a long acting. So
Yes.
yes. Reveal the mystery of the please.
Well, okay, so as we said, type 1 diabetic patients will always be on insulin. With type 2, it kind of depends when the doctor will want to start it. If your A1C, which is your average glucose over 3 months, if that's greater than 10, that's typically a time that we start thinking about insulin.
Mm-hmm.
Not every patient who has an A1C greater than 10 will be on it, but that's definitely a time where we start to start to think about it a little bit. Insulin is the best way to control your blood sugar, but because of frequent injections, it can cause your blood sugar to go too low. It's not usually first line in type 2 diabetic patients, so those are just more your uncontrolled patients that would have to start on insulin. So it's available in a lot of formulations, as we talked about. It can come as a pen, it can come as a vial, and it can also be given as a pump, which is common with type 1 diabetes patients. And really the number of injections, number of units really varies a lot between patients. So it's kind of hard to go into all the reasons that you might be on a certain number of injections, but it really can vary. And there's 5 types of insulin. So there's rapid acting, short acting, intermediate acting, long acting, and ultra long acting. So there are quite a few different kinds out there. So we think of your rapid acting or your short acting. So that's your Humalog, your Novolog, Apidra, Novolin, Humulin. Those are typically going to be your more mealtime doses. So that's going to be something that you might do 3 times a day with meals. After that, your intermediate acting, your long acting, and your ultra long acting are kind of going to give you a basal rate of insulin throughout the day. Mm-hmm. So how your body typically works is it's always excreting a insulin at some level throughout the day. And then with meals, your body increases your amount of insulin. So with the rapid acting and short acting, we can kind of give you mealtime doses to help with the sugar that you're consuming in that meal. But then the long acting will help kind of keep your insulin still present the rest of the day. Right.
Now, someone that's on a pump, they would not use long acting. Is that correct?
Usually, it kind of depends.
Okay.
They can use long acting and then also have the pump, which will just do mealtime.
Okay.
Or the pump can kind of do a basal throughout the day and can give you some mealtime as well.
Okay.
So just making sure, it really is important to get your blood sugar under control. When diabetes isn't under control, it can cause things like blindness, kidney disease, numbness, stomach upset, foot ulcers, and cardiovascular disease, even heart attacks. So it's really important to make sure that you're taking control of your diabetes, that you're taking these medications as needed, or as you're supposed to be taking them.
Right.
And if you have any questions, feel free to go to your doctor, or any pharmacist can really help you and sit down with you and explain your medications to you.
A pharmacist can become your best friend.
Oh, yes.
Right?
Yes.
Yes, because
Definitely.
you can ask questions. You can walk right up to a pharmacist and ask.
Yes.
You don't need to have an appointment. They're accessible.
Right.
And then, sometimes people with diabetes, if they get a cold, or I know you've got some other medications you want to talk about, but you can also help advise these patients, like if they're on blood pressure medicine or some of the other things you're going to talk about, help them decide what cold medicine might work best for them.
Absolutely.
So the pharmacist has a big role in the health of people.
Yes, definitely. Yes,
Yeah.
we're always willing to help. Cold medicines can get very complicated. There's a million out there.
I know,
and-
you look and it's like, okay, eeny, meeny, miny,
Yeah,
mo.
exactly.
But
Absolutely.
yeah, so people should be consulting
Yes.
and ask what would be
Right.
best.
Yes.
Okay.
Definitely.
Well, let's move on into the other medications that you want to bring up, because, frequently people with diabetes are on blood pressure medicine. Maybe they don't have high blood pressure, but the doctor might still put them on blood pressure
Right.
medicine. So let's learn about why that is. And then cholesterol. Why are so many people with diabetes also on cholesterol type medications?
Absolutely. So the next medications we'll talk about are what's called ACE inhibitors and ARBs. So those are both blood pressure medications, and they can actually help protect your kidneys if you have diabetes. So this is, especially if you have high blood pressure, this is one of the first medications if you have diabetes that your doctors will go to. So there's a bunch of them out there, but a few of them. So ACE inhibitors are things like lisinopril, benazepril, ramipril. A lot of things that end in pril will
lot of
be
pills.
ACE
Okay.
inhibitors. And then ARBs, it'll be things like losartan, valsartan, irbesartan, and telmisartan. So anything that ends in sartan. So it kind of gives you a hint with the name.
Okay.
So those are blood pressure medications that can really help to prevent any kind of kidney disease. So things to look out for with that, it can cause a little bit of a cough or swelling of the lips and mouth. If that happens, you want to make sure you contact your doctor right away. You'll probably need to stop taking it. But otherwise, these are great medications. Next, we can talk a little bit about statins. So these are high cholesterol medications that can help decrease your cardiovascular risk if you have diabetes. So a lot of diabetic patients are at an increased cardiovascular risk, so at an increased risk of heart attack, for example, just due to diabetes. So because of that, a lot of doctors will recommend that you're on these medications even if your cholesterol isn't high. So these are for almost all diabetes patients will want to be on these.
Okay.
So these are things like atorvastatin, rosuvastatin, simvastatin, and you can see the list there. So all the statins. So those are definitely great medications.
And you've got the brand names that we
Yes.
might hear too, because we hear commercials
Yes.
for Crestor
Yes.
or
Lipitor.
some of the other ones, Lipitor. So
Yeah, I thought
okay,
it'd
that's
common.
helpful.
Yes, it's hard. It's definitely hard to keep track of medications.
Well,
so.
do the statin medications also help triglycerides?
They can a little bit.
Okay,
Yes, they can.
all right.
So next we can talk a little bit about aspirin. So this is not for all diabetes patients, but it can help decrease your cardiovascular risk. So we typically, when we talk about aspirin for this indication, would be the low dose aspirin. So that's the 81 milligrams. You'll commonly hear it referred to as baby aspirin,
yeah.
but it's not for babies. It's just meaning the low dose aspirin. So one big thing with aspirin is it can cause GI bleeding. So that's why it's not for every patient. So you want to make sure you talk to your doctor about it before you actually start taking it. But that's a great thing that can help decrease risk in these patients.
All right.
Wow. So let's move on because 'tis the season, right?
Yeah.
Let's talk about these days vaccination recommendations are all over the news,
Oh, yes.
and then there's talk on whether or not you should get one over the other. So and let's tell us a little bit about why vaccinations are important, and then why they are important for diabetics.
Right. So vaccinations obviously are important for all for everyone. We want to make sure we're
Absolutely.
all up to date on our vaccinations. Really talking about even if not everyone can receive vaccinations. So if you can, making sure that you get them so that you can protect everyone around you, not only yourself. So especially with diabetic patients, they can be really at risk for these diseases. So making sure that you are up to date on your vaccinations.
And at greater risk of complications
Oh,
because of the
absolutely.
diseases as well.
Absolutely.
That's important for people to understand.
Yes, definitely. So some vaccinations that we really want to make sure you're up to date on. So your flu vaccine. This is flu season, so
It is.
making sure that you get your yearly dose of your
I
flu
had my
vaccine.
flu shot.
Yay.
Everybody out there, raise your hands if you've had your flu shot. Okay.
Yeah, so making sure you get that done here soon. And then also another vaccine is the tetanus, diphtheria, and pertussis vaccine. So the whooping cough vaccine and tetanus vaccine. So you just want that once about every 10 years is typically the recommendation.
Interesting, even for adults. So not
Yeah.
just the tetanus, but
Right.
the whole TDP.
Yep.
Okay.
So you can get it with or without the whooping cough. If you're pregnant or you're around young children, they really recommend getting the one with the whooping cough in it as well. And then shingles. So this is a vaccine that you'll need one time in your life after you're 60. You get it once and then you're done. So that's great because everyone who's had shingles can tell you it's not
I hear
it's not
horrible.
fun.
Yeah.
Yes, yes, absolutely. And then also pneumonia. So specifically diabetic patients between 19 and 64 years old, you want to get one dose of the Pneumovax, which is a type of pneumonia vaccine. So that's specifically for diabetic patients. And then everyone, once you're over the 65, you want to get two pneumonia vaccines. So one what's called Prevnar and one Pneumovax. So you just want to get one dose of each of those and then you're set.
Just one for life
Yep.
after 65.
Yes.
Okay. That's good to know.
Yeah, so just making sure that vaccines are all available at Kroger, so you can stop on in at any time and we can get you taken care of.
Good to know. My mother-in-law, we were just talking with her about this the other day.
Yes.
And I was like, well, I'll find out the answer. Thank you.
There you go. Well, thank you
good.
so much, Nicole, again for your help. And I happened to look at Krogers.com/pharmacy this morning and was able to look up things by topic. And it's a very helpful, website to be able to look at. So we thank you so much for all of your help and insight today. And again, everyone, if you have any questions regarding what you've heard today or any of the events that are happening for the ADA, please, again, feel free to reach out to us by email. Again, my personal email, afreeman@diabetes.org, or please feel free to also look at our social media sites, Facebook, Twitter, and Instagram for more information. Thank you again for hanging out with us today on Stop Diabetes Insight.
And we also want to thank Kroger for being such a
Yes.
top supporter and friend of the American Diabetes Association. So thank you.
Thank you. So on behalf of Carol and myself, we'd like to say happy Tuesday to you all, and we will see you next month.